Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Whether you're a GP, pharmacist, advanced nurse practitioner, ACP or physician associate, you're delivering frontline care and clinical risk is your daily companion. Patients are getting more complicated and the working day is getting busier. Remember, it's not about avoiding risk, it's about managing it smartly. So today we'll dive into 5 practical ways to spot, manage, reduce your clinical risk in clinical practice. So let's get into it. We must firstly recognize that all care has risk. This is the first mindset shift that is needed to accept that every patient interaction involves some level of risk. Even seemingly benign presentations can mask serious pathology. Take, for example, a patient presenting with lower back pain. It's tempting to treat this as mechanical, especially if the patient is young and active. However, consider those red flags: weight loss, night sweats, a loss of urinary and bowel continence. And if you do, you could miss something sinister like malignancy or cauda-equina syndrome. Rather than trying to eliminate all these risks, think in terms of risk management. What's the worst case scenario here and have I safely ruled it out? This approach helps you stay vigilant and avoid premature closure of a patient. Don't skip these red flags. Guidelines and checklists aren't about ticking boxes, they're about clinical safety nets. When under time pressure, it's easy to neglect these to go to the most likely diagnosis. However, red flags must be actively ruled out. Take chest pain, for example. It might well be musculoskeletal in a 30-year-old with recent gym activity, but without asking those exertional symptoms, family history, associated features like shortness of breath, pleuritic pain, leg swelling or nausea, you may risk missing a cardiac event, even in someone typically associated as low risk. Similarly, a headache that could be a tension type could be a subarachnoid as well. So look for the sudden onset, severity, and classic thunderclap description. Make a habit of asking the questions you don't want to find the answers to. This may be helpful to use risk calculators, Centaur, Glasgow-Blatchford score, etc. And these are all designed to make you a safer decision maker. Safety net like a pro. Safety netting isn't just a formality at the end of consultation, it's a core risk management strategy, especially when working with diagnostic uncertainty. Good safety netting gives the patient clear expectations about what should happen next, what symptoms to look out for, and how to seek further help. For example, if you see a patient with suspected viral gastroenteritis, advise them their symptoms should improve within 48 hours. But if they do develop signs of dehydration, persistent vomiting, or blood in their stool, they can always return or call 111. Always document your safety netting advice clearly in your notes. It does show throughout the process how your thought process is going and protects you and the patient if things change. Poor safety netting is one of the most common themes in clinical negligence claims, especially when the initial diagnosis was reasonable but deterioration wasn't anticipated or followed up. Know your limits. One of the most important and sometimes underappreciated ways to reduce clinical risk is knowing when to seek help. None of us can know everything and frontline work is unpredictable. The key is to develop your own awareness of your own boundaries and to escalate early. Let's say you're an ACP assessing a patient with abdominal pain. You do suspect appendicitis, but the picture isn't very classic. The patient's observations are borderline and they're not peritonitic. This is exactly the moment to involve a senior colleague and perhaps think about what we should do with this patient, not when the patient starts to deteriorate. The same does go for prescription queries, safeguarding, and when your gut feeling just tells you something isn't right. Asking for help isn't a sign of incompetence, it's a sign of good clinical sense. It protects the patient, but it also protects you legally and professionally. The last tip for today, document properly. In clinical practice, your documentation is your defense. If anything does go wrong, and even the best care, it can happen, your notes need to show that you made a reasonable decision based on the information available at that time. Document your working diagnosis and how you've considered and excluded, especially red flags, any examination findings, your safety netting advice, and your shared decision making that took place. For example, in a consultation about sore throats, don't just write pharyngitis, advise conservative management. Include no red flags, obs normal, no dysphagia or shortness of breath, advice to return if symptoms worsen or fever over 48 hours. Patient happy with plan. This level of detail doesn't take long, but can make all the difference if someone audits or reviews your notes later. Oh, and here's a bonus tip. Be kind to yourself. Remember, working on the front line is intense, emotionally demanding, and full of uncertainty. We can all make mistakes, overlook things, get blindsided by patients who don't present classically. Clinical risk isn't just about protocols, it's about resilience, teamwork, and support. Make time to reflect, debrief, and talk with your colleagues and seek that supervision. Talking about difficult cases isn't just educational, it's vital for your mental health. Burnout does increase when there is clinical error. A supported clinician is a safer clinician. So remember, managing clinical risk is all about being systematic, curious, collaborative, and reflective. Trust your training, stay humble out there, and don't work in isolation. And with these small habits, you should be a safer, more confident practitioner. Thanks for watching. If you found it helpful, do hit the like button, subscribe and share with a colleague. And if you've got any clinical risk stories of your own or tips and stories, do drop them in the comments so we learn best from each other. See you on the next one.